discuss today retrocalcaneal heel spur and how we're going to treat this as opposed to what we normally do. We like to do minimally invasive surgery if we can, but most of these patients also have issues with a tight tendon, so if we do a minimally invasive resection, a lot of times we'll also address the tendon. Now, who is appropriate to do the MIS on and who is appropriate to open it up? That's a question that needs answered before we get into this. So if you look at this patient we're going to do tomorrow, this patient has a fairly significant painful posterior heel spur here. And if you look at this deformity, there's actually two parts of this deformity. There's the pain of the tendon, and there's also pain at the top of the foot here. You see how the superior portion of the haglund juts up like this? So when a patient pulls their foot up, this is hitting into the bone and causing pain in the tendon. So if you were to go in here and do a procedure where you just remove this spur, it's not going to get rid of your pain. You've got to address the haglund portion and the spur. That's the case with the majority of heel spurs that you see. Patients that have gone to other clinics who've had just this spur removed, many times, I don't know how many successes they have, but I've seen these patients come back without relief in their pain. So you got to look at this deformity. It has two deformities. So for this particular patient, not a good patient for minimally invasive, because if you look at the tendon, see where the tendon is getting tethered fairly significantly with a spur. So this needs to be opened so that we get a good resection of the actual spur, and then we also can take this haglund formative portion off too. Now, one of the advantages of this is we're going to detach the tendon so that when we put the tendon back down, we'll move it forward. So in effect, by moving it forward, that's called a Murphy's procedure. That actually reduces pressure on the back of the heel. So that's actually in effect lengthening the tendon. So you're getting 2 in 1 here. So for this particular patient, we're going to go traditional because it's not very amenable to minimally invasive surgery. Now, if it were just this haglund formative portion and she didn't have this spur here, we could take a burr and take this bump off, and we could lengthen the tendon with a percutaneous incision, and that would give a lot of relief to this patient. Now, some of these patients ironically get relief by just doing the tendon, but I have some friends who do that, but I don't get as much results with that with a true posterior heel spur. So when I see this retrocalcaneal spur, I start edging my way towards open procedures. However, there are some patients we can remove the spur, especially if it's like in the tendon here. We can kind of go underneath and around the spur, leaving most of the tendon intact, and also taking the haglund deformity off. Now, I've seen people describe this by just doing the spur. I would think that would not work because you're still going to have the haglund portion. I think it would be a rare patient to have to find a posterior heel spur patient that does not have this enlarged superior portion of the ankle of the heel. So this is a problematic issue for patients that have this deformity as well, and that has to be removed. So that's my take on that. So that's how I look at that. In which patient, this patient tomorrow morning, we're going to do a traditional procedure where we detach the tendon and reattach it, getting rid of the spur and the haglund portion at one time, and then advancing the tendon forward to give us some theoretical lengthening of the tendon.